Yeah.
Over here.
Right here.
Yeah.
Hi Teresa, can you see me?
Yeah. Hi.
Hi, how are you doing?
Well, I'm a little better, but I still feel kind of weird.
Okay. I'm one of the stroke neurologists at the University of Minnesota in South Hill, and the reason we have these cameras is so that we can come to you instead of bringing you to the stroke specialists.
Okay.
I understand this happened to you about a month ago as well. Was it something similar?
It was like this. Well, in that case, that one I couldn't remember my kids' names, and
Okay.
It was a similar episode, but it wasn't to this extent where she wasn't able to walk. And when she lives with me, I came home and she basically said she wasn't able to like get out of bed because she was like bobbing around.
I couldn't walk.
She wasn't able to move her feet forward, to like take steps. Couldn't get out of bed. She had a different, like she sounded like she was drunk when she was talking.
Any double vision?
No, my vision's kind of weird, but it's not double.
She's had
Okay.
a bunch of different episodes where she's complained of dizziness, though, to the point where she feels like she's gonna pass out. She's been falling.
Okay.
Yeah.
Let's go ahead. Let's try a few things, and then I already have your MRI scan, so we can talk about it afterwards. Okay. So let me start by asking you. Do you know what month it is?
I think it's April.
Good. And what year is that?
2009. No, wait. 2018.
Okay. How old are you?
I think I'm 63.
Okay. Good. Are you more confused than you are normally?
Yeah.
You are? Okay. And what else would you say are the main reasons you came in? Confusion, not being able to walk, anything else?
This time, why did I come in? It's because when I walked, it didn't feel right. I felt like I was tipping over, leaning towards one side. And I didn't get out of bed all day because the first time I got on it was okay, and then the second, I thought I'm not going to try anymore because it was difficult when I tried the second time. I couldn't get up on my, I should get up on my elbow. Yeah.
So let's try a few things.
Okay.
I want you to keep your head facing towards me.
Okay.
Okay, Teresa, look at me. Now then, with your eyes, look to the left at your family. I want your head facing me, but look to the left over towards your family. Good. Now look to the right. Then look up. Look down. Close your eyes really tight. Squeeze them down. Shut. Good. Go ahead and open your eyes. You can open your eyes. And then I want you to hold your arms out in front of you like this, like you're stopping traffic. Can you do that with both arms?
Yeah.
Good. And then let's try this. How about turn them over so your palms are up towards the ceiling? Turn them over. Okay, that's good enough. Go ahead and keep them like that and close your eyes. Keep your arms up.
I got something here.
Okay, hold on. Keep your arms up for me. And close your eyes. Keep your arms up. Get your elbows up. With your eyes closed, take your right index finger, touch the tip of your nose. Okay, do the same thing on the other side. Okay, good. Go ahead and open your eyes, and I want to test your feet now.
What?
So can you test your legs, okay? So can you hold your right leg up in the air off the bed?
Why hold it up?
Yep, just like that, perfect. And keep it up for 5 seconds. Keep it up, keep it up. Don't let it fall, don't let it fall. Okay, good, let's try the left side. Good, looks like the right side's a little weaker, huh?
Yeah. That's the side
Okay.
I
Now,
felt was weak.
let's take your left heel, place it on your right knee. So left heel and put it on your right knee.
My left heel on my right knee.
Yep, I know this is, okay, now slide your heel down your shin, so down and back up.
This?
Just nice and smooth. Yep, all the way down to your foot and then back up. Back up. Excellent. Same thing on the other side, please. Okay, looks like you have a little difficulty on the right side still. Okay. Is the nurse in the room with you still?
No.
I don't know.
Okay. Can one of you stand up by her and help me examine her with a few things?
Sure.
What's your name?
Michelle. I'm her daughter. She lives with me.
Okay. Great. All right. Thanks, Michelle. So what I'd like you to do is just touch the right and left side of her cheeks and see if they feel the same on the right and left side.
Yeah.
Does that feel the same or does it feel different?
He's asking you. Does that feel the same or feel different?
To me?
Yeah.
Yep.
Oh.
Is your sensation on the right and left side the same?
Yeah. I thought you were
Okay, good.
her.
Yeah, no. All right, let's test your arms as well. So let's see if the sensation on the right and left arm are the same. Does that feel the same,
Yeah?
Teresa?
Yeah.
Okay, good. And let's test the legs as well.
Yeah.
Okay, good. Now, Teresa, can you just clap your hands together for me? Can you clap your hands together?
It's hard to get all this crap.
Or with all that stuff on. That's okay. That's fine. So, everyone who's there, I'm going to try to show you the pictures of your brain that I'm seeing. Okay, they should come up on the screen.
Okay.
So if you want to see the pictures, I would come closer. It's going to be kind of small.
Okay.
I would just come closer with the rest of you to the screen here. All right, give me 1 second and I should be able to show you, okay?
Okay.
What?
Teresa, this is the scan of your brain that shows a stroke, okay? You've had a stroke today, or probably overnight before you woke up.
Okay.
It's going to take me 1 minute to bring it up, okay?
I want to sit up.
Okay, let's take this pillow off. Wait. Hold on.
Just sit up.
Okay, can you see pictures of an MRI scan now?
Yes.
Okay. Let me show you the scan that I'd like you to see. So, do you see one picture now in front of the others that's bigger than the rest?
Yes. Yeah.
Okay. And do you see the arrow on there?
Yes.
So that area there is the stroke. That is the back part of the brain near the bottom that connects the spinal cord and the brain. And so it's interrupting the tracks that run from the muscles on the left side of the body or on the right side of the body up to the left side of the brain. To give you an idea of where this is, at the very top of this picture, you can see her eyes very faintly. Do you see those there?
Yes.
Okay, I'll try and just draw a line in. So that's one of her eyes up there. Can you see that mark that I put in?
Those are your eyes, Mom.
Okay. And then this is the nose right there. And she's laying down as if she was in the scanner looking up. So this stroke, which is back here, is really deep in the brain. And if I scroll this picture up and down, I'm going higher in the brain and everything up here looks fine.
Okay.
I think it might have lagged a little bit there, but so you can go to the top of the brain and everything looks fine. This is, up right underneath your hair. And then as I keep coming down, we get to the area with the stroke, which is right here.
Oh. I can't.
What are you trying to do, Mom?
I'm gonna move you a little so she can see better.
I'm sorry.
Can you see?
Yeah. Okay.
Thanks. Who's that?
Who's who?
That's my.
Who moved the?
What did you say?
I don't
Okay.
know.
I was just wondering who moved the camera. I can't see you because you're off screen. But so anyway, so this is the stroke, and if we keep going down, you can see that this really becomes the spinal cord here in the back of the brain. So it's an interruption between the right side of the body and the upper left side of the brain and the right side of the body. That's why we see that right-sided weakness, especially. And the important thing is to get you on the right medications to prevent another stroke and have them do a stroke evaluation in the hospital. Because if you have one stroke, you're at risk of another. And the way to lower that risk is to get you on the right medications for the stroke risks you have. Do you have high blood pressure?
Well, I had high blood pressure. The last couple times I was in, it was normal, so they took me off hydrochloric acid.
Do you have high cholesterol or diabetes?
I had that too, diabetes, and they took me off
Okay.
both my medicines.
Okay. And do you smoke?
Yeah.
You do. Okay. So we'll look at your your blood pressure, your blood sugars for diabetes, your cholesterol, and look at your heart as a potential cause of stroke as well. And you also get evaluated by physical therapy, speech therapy, occupational therapy for some exercises to improve the weakness you have. Okay.
Okay.
Does anyone have any questions for me?
What do I do in the meantime?
Well, you'll go into you're not going to stay in the emergency room. They'll get you into a hospital bed. And then they probably won't do too much testing tonight. It's almost 10. So most of it would be tomorrow.
So I do have a question. Like, basically all of these symptoms, they were very similar last time, and it wasn't a stroke. But they ended up having her in, and they found the pituitary tumor. Is this any relation with the tumor? Or is this, because this has been, she's had stuff going on for like the past year. We've been trying to figure out what's going on with her. Like, she's lost 70 pounds in a year without trying. It's basically loss of appetite. She has, like in the state she's in now, it's bad, but she's not a lot better from, like, being able to, like, full mobility. Like, she needs help getting in and out of the car. So it's just like her, like, livelihood has declined within the past year. She was working last year. And so we're just
Yeah, so good question. So this is not related to the stroke, what you're telling me from before. So that picture that I'm showing you on the MRI scan, that happened, basically overnight. We can tell by the way it looks that it's not older.
okay.
So no, I don't think that they're related. I think the pituitary adenoma may be related to those longer symptoms, but the stroke itself is probably not related. Now, what she had last time might have been a mini stroke that went away. The evaluation showed a pituitary adenoma rather than the stroke because the stroke disappeared. I didn't see her then. It's hard for me to know for sure.
Okay.
But that's a good question. I think that explain, a long-standing decline like you're seeing. This is really something that just happened.
Yeah. And basically, like, we went and seen a neurosurgeon at the U, and they had said that right now, like, focus on making sure that this isn't like a reoccurrence of cancer, because she's had breast cancer before, and then she had all these different things on her MRI showing like white matter on her spine, and then they just
Hi there.
found out that it was arthritis. And so, but they were worried that it was possibly bone cancer. And so she went through all that and did the PET scan and everything. So basically, hasn't been any talk about treatment of the tumor as far as right now, because he's like, let's figure out everything else. He said.
Are you seeing an endocrinologist?
She did, yeah.
Okay, so the treatment of tumor, it can either be surgical or hormonal, and I'll tell you first that that's not my field. I don't do that, so I won't be the person who decides what you do. But it's not a huge tumor, and because it's not compressing anything, it doesn't necessarily need to be treated surgically. I would be worried that some of the weight loss and those things are hormones related to the pituitary tumor. It can secrete hormones in that case, and that would be managed medically.
Sorry, I didn't mean to cut you off, but they said that it wasn't the secreting tumor where it was releasing hormones.
Okay, well then, it needs to be looked up. I mean, there's not a great relationship between these things, except cancer does slightly increase the risk of stroke. Okay. This type of stroke is classically caused by high blood pressure. That's the typical cause in the location that I showed you. But that's part of the reason that you would come in for some more testing.
Okay. Yeah, we were basically.
Well, I was worried that they took me off my blood pressure.
Yeah. Well, I don't know. You've lost a lot of weight, and obviously have had some changes. So, I don't know how that's impacted the medications that you need. I'm seeing you here at one point rather than this whole period. But it's something that can be readdressed. Having high blood pressure in the setting of stroke, by the way, is not necessarily something that you treat. Your body wants pressure to be high when you have a blockage. So I don't know that blood pressure is something that we would change treatment a lot, but we'll check labs that shows your blood sugar level over the last 3 months, so we would know if that's being treated appropriately. We would check labs that show your cholesterol, which is a reflection of the last 6 to 8 weeks, so we get some longer term data there, and then take a look at your heart with an echocardiogram and some things like that. But I don't think that this is directly related to the pituitary adenoma. I think it's sort of a unlucky coincidence.
Okay. All right.
Okay. So I'll call back to your emergency room doctor down there and coordinate getting you admitted, and they'll go from there. And I hope you're able to get to the bottom of some of these questions. But I don't think the stroke is directly related to them.
Okay. Well, thank you. Do you have any questions? No?
All right.
Thank you.
Thank you.
All right. Thank you very much. Bye.